Mental health issues are among the most common conditions in the United States. From high anxiety to depressive slumps and a number of other mental disorders, internal battles affect people of all ages.
We see coming through the pandemic especially how fragile some of our community members are and how the infrastructure for our mental health system has been so challenged.
According to the CDC, the number of adolescents reporting poor mental health is increasing.
Suicide is the second leading cause of death for individuals between the ages of 10 and 14.
In slightly older groups, nearly 1/3 of young adults age 18 to 25 experienced some sort of crisis.
If you want to work with young people, you have to work with mental health. That is a reality of today.
Arnot Health and local faith leaders are finding ways to better the emotional, psychological, and social well-being of the community.
We need to know what to do when people are thinking of ending their own life.
Spiritual leaders work directly with patients.
We occupy this wonderful little spot where people don't quite know what we do, and they think we're just nice people who come in and hold hands and say prayers, which is true to an extent. But in another extent, it's also like, oh, geez, I need to get a psych consult for this person because something is really wrong here.
Noticing behavioral differences in patients as they navigate their journey across various clinical settings.
And I realize that their affect is completely different. But those nurses don't know that. I know it because I go from unit to unit to unit. They don't know it because they haven't seen it.
Pastors, priests, and other clergy members might see the same changes in church members. With the right resources, they can offer more help to the community before it's too late.
We really want to make sure we're continuing to advance our programming, advance our learning, really be seen, at least in healthcare, as a center of excellence for spiritual care within this region.
Care that starts with judgment-free compassion.
What I'm here to do is to be a companion.
In any setting, the goal for any spiritual leader is simple.
We just want people to get the help that they need.
If you or someone you know is struggling, help is available. Call or text the national hotline at 988, or in urgent situations, it's best to call 911. For Arnot Health, I'm Lexi Cutmore.